everyone, and welcome to this edition of the Higher Estate Podcast. We have an amazing group of people that are here today, and I'm excited to get this shit on the road. Damn, I still swear. I'm trying not to swear every time. I keep telling my mother, I promise her I won't swear.
With her and her friends.
I do. I get in trouble with her all the time. Anyway, we're bridging the gaps between the medical and recreational lifestyle world when it comes to cannabis, and we're talking about things that relate to our world as we know it today. We have usually beautiful Janelle is here. Hey, Janelle.
Hey.
How are you?
Not bad. Just living in this pandemic lifestyle, getting used to lining up for everything.
How's your daughter? Your son.
My son.
Yeah. How's your son? I was thinking my daughter when I said that.
He's good. He's just wondering why, where his friends are and what's going on.
Does he have any friends? Because I'll tell you, my daughter hasn't seen a single person in a month. I feel like she's gonna come out and be socially.
He actually has a few friends, like his little besties from daycare, and he had his first virtual play date. Like these are actually a thing now. You do a video chat, like mom to mom or dad to mom, whatever the case may be, and you just let the kids talk. And it's actually amusing because they'll just be like, hey, I have this toy. What do you got? What are you doing? But that's how he's interacting with his friends now.
I think it's a lot stricter here. It must be a lot more strict here because I'm looking at another awesome human who's out west in Victoria. Dude looks like, first it looks like it's an amazing day, not like our overcast crazy, but he's also just chilling and enjoying his life over there. We have Mike Forbes today, who's like, who I've known for a couple of years now, and this is an amazing human. He's a pharmacist by background, but he's an entrepreneur, and he really is dedicated to improving both the world and Canada, and doing so much in both the cannabis realm and in the medical realm and wellness realm, and changing people's lives. So we've got him today, and we're going to chat with him as well. What's up, Forbesy?
Thank you. Likewise, Ira, you're an amazing human yourself, and you as well, Janelle as well. It's nice to meet you and have and for you to both have me on the podcast. It's awesome.
I don't understand what's going on out there, because if you look at Janelle, and I want to talk to you about that, but I don't understand what's going on in Ontario. You're not allowed to walk outside without getting a ticket if you're walking in three or four people. And then out in BC, people are sitting on their boats, they're going to their cottages, they're doing all this stuff, and I don't know what. First of all, I don't even know wear pants, because everybody's doing home. People can do work from home now, and show that we got that slide, and because we're all working from home, it's like pants are optional. You know what I mean? Look at this guy. This guy is the perfect example of what it's like to work at home right now. You know what I mean? This guy's got he's got his hook on the side of the beer. Yeah, and this
pants, Ira?
What's that?
Are you saying you're not wearing pants?
You want to see? No, you'd probably rather see Forbes than me. 6'3". How tall are you, Forbes?
6'2".
6'2", yeah. See, I just need a little more height. Let's see. But I did shave my head so I can Purell.
Look good.
Yeah, some people say I look a little younger. I don't really know.
It's a good look.
What do you think? So, what are your thoughts on this? Show that that photo there of our prime minister. Couldn't remember his name there for a second. Of Trudeau. So this past week, what are your thoughts? We've got Trudeau that's out there. He's able to go to the cottage, and he's hanging out with his family. Posts this on the on his wife's Instagram. But then these guys at the bottom here, they're doing the same thing. They're just out in their backyard, basically, just at a park in Oakville, and they got $800 ticket. It's pretty crazy. What do you think about that?
Yeah, I think that in the context of what governments are trying to get across is to have that social distancing and separation. Where I think the picture with Trudeau going to his lake place I mean, if you think about it, though, it's more about the smaller communities not wanting a big influx of people coming to them, right? And so, yeah, I mean, you got a really good point there, Ira, with your post there. Like,
where are we?
You know, like in BC, it's much more less enforced. It's more of like a recommendation, but we haven't had the same numbers that you've had there in Ontario. So, I mean, it does make sense if you do want to go to your lake place and you don't meet anybody and you just go straight there and you're just isolated there. But it does send the wrong message with what Trudeau's doing there, for sure. It's a bit hypocritical, for sure.
Yeah, I mean, I read this article yesterday that was saying, at some ways I guess we have to understand there are some leniencies for the guys that, for specifically for him, he's prime minister. If he's got to go somewhere, he's got to go. And his family has been sitting out there for a couple of weeks, so he wanted to go visit them. Right. But the message of I think the issue for me is the posting of it. I get that, these things happen, you're doing that. But like, if you're posting it, I mean, you don't have to rub salt in the wound of all the rest of us that are really just trying to do the right thing. Yeah. You know what I mean? He's prime minister. He's got to do shit. So he can't stay there. He has to travel.
Yeah. I think it's hard especially because a lot of people heard the recommendations coming from like senior officials recently saying like, don't go to your cottage because these small communities, their hospitals can't handle the influx of people if there's an outbreak. So when you hear that, and a lot of people, like I have friends in Toronto who wanted to go to their cottage and they're like, okay, you know what, I'm going to be respectful, I'm going to stay home. And they've stayed home. And then you see the prime minister and his family, they're having a wonderful time up there for the Easter weekend. Then it's like, well, should I have gone? Like, what, right. Like, am I listening to this if the prime minister isn't listening? And I do understand that there are certain concessions that get made for them because their family is one place, they're another. And right. I mean, you want to be a good parent at the end of the day above your politics and whatnot. So I agree with you, Ira, in that it's one of those things where you don't post it.
Right, you just don't post the shit. Like why like honestly, I'm not posting like my daughter sitting on the iPad all damn day. You know what I mean? Like when she's supposed to be doing homeschooling. I guarantee you 90% of the people aren't doing the homeschooling shit that they're, that all these schools are sending right. out. And in the meantime, we're just trying to survive. I'm not posting it all day because you know what I mean? What kind of message is that? I don't want them to know that I'm a shitty parent. I want everybody to know. I'll post a photo of my daughter sitting, eating dinner, having family time. Yeah, like passing, like doing like grade 8 work in kindergarten. That's kind of.
I think the real issue, though, you guys, is that we're having all these social distancing rules, and which is great, and then we're focused on preventing people to migrate into the small communities. But really, I mean, I just want to point out, like Alberta, their procurement officer was a rock star and got millions and millions of extra N95s and PPE for all, and now they're sharing it to Ontario and BC and Quebec and whatnot. Well, why is it like who at the government level is just sitting back and getting their cushy salary? When Bill Gates 5 years ago was warning of a pandemic, like we had SARS in 2009. Didn't we learn our lesson? Like why? And then I read that we burned $55 million worth of PPE because an expiry date went by. Like, that's honestly, so crazy. Who are these people and why aren't they, like, if they worked in the private sector, they would be fired.
Yeah. Oh, for sure.
How hard is it to mandate a jumbo jet, fly to China and load it up full of PPE and fly it back? Like it's 13 hours from Vancouver to China. Maybe it's, a day to load it up, worst case, and then 13-hour flight back. So literally, it shouldn't take you more than 48 hours to get millions of supplies to Canada.
It makes no sense.
And then it's deflecting the whole issue about you can't go to your cabin in the woods and do this because of the small communities don't have any PPE or supplies. Well, it all traces back to why isn't our governments more accountable? I mean, we're now into almost, middle of April, and this has been it was warned as a pandemic, 3 months ago?
Yeah, even in December, people were were out saying it was a pandemic, and maybe the WHO screwed it all up and the US pulled out their funding. But you have a really good point. I mean, just get on the fucking plane, get a jumbo jet, go out there, bring back all the shit. And
well, I've sourced. So I'm with the COVID Langford response team. We've gone out and sourced all of our protective equipment, and we've given it to the authorities. And we've why and I'm a busy guy, and we're all busy people. But how come I can go and source this? It drives me bonkers that the government just sits there and counts on the news how many cases there are. Well, my 10-year-old could do that.
We get caught up in the politics of things. It's funny how we look at so many things and they can be so black and white. But there's all these political red tape that the powers that may be get caught up in, and then we get left behind.
It's a total lack of leadership at the political level.
I agree with you. I think it is a lack of leadership at this point in time. I mean, and lack of planning. We've been in isolation for a month. Don't you think we should have been planning for the exit of that? Don't you think we should have been planning during this month? What were we doing for a month? Just planning for the next isolation phase? We could have had all this material here already. I have people every day saying, I've got access to millions of N95s, Ira. Where should we send them? I've got access to millions of X, millions of Y. In the meantime, I'm looking at our hospital in particular, and I think we can generalize to every hospital around our country. We're saying, we have only 7 days left, or for us, we have 2 days left of isolation gowns. But yet I've got people calling me left and right saying I got millions of these things. So I think you have a good point. Just, we're deflecting the issue. We're saying stay home because we don't want to overwhelm our cottage country. But yet it's pretty easy to get them the stuff they need if we were willing to make the move. That's a good point you raised there. Okay, everyone, let's move to our guest, who has been doing amazing things for COVID, but he's also an amazing human who's been doing some crazy entrepreneurial things, and that's Mike Forbes. Hey, Mike.
Hey guys.
I met Mike a couple of years back when I was doing. I was writing an educational platform for, I think it was McKesson Canada. And Mike Forbes how many pharmacies did you have at that time?
I don't know. Yeah, I have quite a few, a dozen or so.
Yeah, he had a whole lot of pharmacies. And he was doing some really awesome work, and we became friends through that. But he's doing some really cool things. So I want to get this thing isn't staying today, and I don't know what I did to break it. So I'm trying to get this mic to stay. Oh, there we go. I just had to tighten it. So I really wanted to get into my real question, because he's doing so much in there, and I want to learn about who you are and how you got into the cannabis industry. But Forbes, if you can just give us a brief history of your pharmacy the pharmacist you into the entrepreneurial you into what you're doing in cannabis, because really I want to get into what is the state of the recreational world right now, and where are we going? Where are we heading? It seems like the whole thing is basically just imploded. And where do you see it? And how are your companies doing, and where do you see them all going? So I'm going to turn it over to you just to tell me a little bit about who are you, man? You were a pharmacist. What happened?
Yeah, so I think I just have a curious mind, and I just I just look at problems as how can I solve this problem and make it better. And I think that's at the core of what an entrepreneur is. It doesn't matter where you started, whether it was in medicine or pharmacy or construction or law or whatever. You can still create a better world and find new markets. And as a pharmacist, I started getting, when I'd have complex patients come to me with, a lot of it was through menopause and midlife, and how they just weren't feeling themselves. And so I started looking at other therapies about what was working for other patients, and then talking to those physicians. And then that's what got me on the path of age management medicine. And through age management medicine, I went to Harvard and did a lot of training there with, what other parts of the world were doing to, treat disease and extend life and prevent. And it was through that it opened my mind to be, well, everything in pharmacy and Western medicine is not the only answer to health. And at that, a few years later, cannabis started to become very, in the media, and there was a debate of whether it was going to be legalized or not, or whether it was good for you or not. And all that debate went on for years.
Yeah.
And so I became curious and started researching it and, looking into it. And it convinced me that, how can we, if you look at the, pain control with opioids or anxiety meds, and the actual outcome to prove whether those meds are working or not is actually based on how the patient feels.
Right.
That's it. And so it's, how can you then argue that cannabis does not help you feel better with your anxiety or pain or other ailments? And so you have to look at things objectively and go, just because of society said cannabis at one point was bad for you, you have to have that strength to look in yourself and be like, well, where is this information coming from? And do I have to believe that? And for me, it was a hard no. And so I feel that evil prevails when good people fail to act, right?
Mm-hmm.
And so being a healthcare worker, I built a number of clinics and gave them to doctors, and I worked a lot with other doctors, and they were very much against what I was doing. And I just took it on the chin and said, this will come around when, when it all comes out of the wash. You're seeing now that like cannabis is an essential service and it is making a big difference in people's lives. And who are you to judge those people if it's helping them? You don't know their pain or problems.
Hey,
And
question
so,
for you. One sec, just on the essential service, are your stores allowed to stay open? I know our stores are closed. Yeah, except we're allowed to do curbside deliveries.
Yeah, and I mean, that's a start in the right direction, but like I put up plexiglass shields in all the counters. I've been, 6 weeks ago, I had all my staff wearing masks, and I was running around getting them PPE equipment because I did not believe that the CDC guidelines and the WHO for Western societies was right. I thought it was wrong.
Right,
because you look
awesome.
at all these other Asian countries and you look at the stats from them, and it's, even if you're wearing like a handkerchief or a makeshift mask, it still shows a decrease of, moist droplets going and infecting other people. So why are the governments saying that you can't or you shouldn't wear a mask? It's only covering up that they weren't prepared.
Yeah. I totally agree with that.
With my businesses, immediately I was putting in protective measures. Like I made floor stamps and distributed that all over my city, and put up plexiglass shields for the staff. We had hand washing, like, crazy hand washing on everybody. Alcohol, like I have in my pharmacies, I have labs, and we've been making hand sanitizer as fast as we can. And everybody had masks, and I took a lot of flack from other healthcare workers saying, hey, you should be donating your masks to the hospital workers. And I'm going, what? So because you work in the hospital, you don't think that the pharmacies need masks? Like
100%.
On average, a pharmacist sees 400 patients a day. Well, how many does a doctor see in a day? 30? Like, give me a break. And so I think it's more about everybody should be wearing masks in public, and especially in essential services. And so being a pharmacist in cannabis, I was very aggressive in protecting my staff, because I couldn't sleep at night knowing that if my people are going into work and I didn't do my job to provide them with the safety and the personal protective equipment they need, and they get sick, I would feel horrible. That's on me.
Wow.
And that's the government it's unbelievable that you as a doctor, Ira, and I have lots of buddies who are having to go and intubate a COVID patient to a ventilator. And at that point, it's now aerosoled, and they don't have full protective equipment. That's the equivalent. Imagine if Imagine if the cities were going around with the building code saying, "Oh, don't worry about that asbestos. Just go in there and clean it up. Don't worry about getting sick." Well, what would be the legal ramifications of that?
Yeah.
They're basically saying the same thing, that they actually are saying that and
It's unbelievable.
they had a debate this week. Does a physician have the duty to go to work if they aren't provided the equipment to do their job fully?
Right.
And who's liable?
And I think who's liable, right? So I don't think anybody wants to take responsibility for it. It's driving me fucking mad, actually, to the point that it's to the point that you raise. I keep hearing all these physicians in in positions of authority saying, well, this is the recommendation. This is the recommendation. You don't have to worry about this. You don't have to worry about that. I mean, your asbestos analogy is actually an excellent one. I was using would you send the soldier into war in flip-flops with a broom as a weapon? But I like the asbestos one because I think most people can hit home with that. Nobody's walking into a place that has asbestos, and with
the liability with all the precedents of the court cases about people, the manufacture of asbestos, and if you put workers in there, there's a huge precedent that you are liable for their health costs and their death. Well, the government's just saying, oh, you don't need masks, you don't mean that, and now they're saying, oh, whoops, now you do. It's just because they weren't ready. And so back to cannabis, I think that a lot of operators in cannabis are scared. They don't have a medical background, and they're lacking in some leadership of preparing their staff to have the right equipment and to feel like they are valued for helping society around them, right? And I think that a lot of stores have closed because of that. And I think that there's a lack of pressure on the governments to say, honestly, guys, like when that click and collect thing came out, I within half an hour, I was writing letters to the government for cannabis control saying, really? How come you're allowed to sell deliveries to your house and we have to still have it click and collect? Like, you're still causing people to leave their homes and come and pick it up, and there's still a transmission point there. Well, how is that fair? And what is the big deal? You can, the black market's going wild selling online, and why isn't the police and government clamping down on them when we've been beat up through the plain glass window with all these costs and overheads, and there's no, it just makes you angry. You're trying to do the right thing, and
are you staying open? No, I love it. I totally agree. You are staying open?
100%, man. Like the amount of people that need cannabis just to function is amazing, and it's better for you than being on benzodiazepines or opioids or alcohol or any of that. And so, look at the message the government's saying, well, alcohol is an essential service.
I was just like, how do you feel about the government saying, like, hey, cannabis is an essential service, and as quickly as they said it, they pulled back, as particularly in Ontario, they were like, wait, hold up, you're not actually an essential service, close your stores. And then now we've moved to the curbside pickup. Like, what are your thoughts on how quickly they flipped and flopped with that, but alcohol in the running?
Exactly. There's a lack of common sense going to the government saying, like, what are you trying to prevent here? Like, we've already proven that crime has gone down with cannabis legalization. We've already proven that child use has gone down. You can't die from cannabis. The government's able to ship it online to your door in BC anyways, and the black market is. So what are you trying to do here? Like, it doesn't make sense. Like, it should be allowed to be delivered to your door, period.
Interestingly enough, in Ontario, they're not even delivering it to your door. They're basically giving you a Canada Post notice and then forcing people to the post office, which is, in my opinion, counterproductive, because then there's these long lineups just to get your cannabis, which we're trying to avoid that physical contact, right?
So in the pharmacy boards, they've declared a state of emergency at the college. So Ira has a college board of physicians and surgeons that he reports to, and I report to the College of Pharmacists. And so if you take a look at methadone, for example, which is which is it's a derivative of heroin. It's just not as fat soluble, so it doesn't get into the brain and make you high, but it treats all of the same physical dependence that opioids do. Well, pharmacies now are able to deliver methadone to people's homes, right? Carte blanche, right? And if you think about the severity of heroin versus cannabis, like, where's the common sense here? You know, with the governments, like, it leaves me speechless.
Yeah.
To be honest.
It actually, you raise another good point. We spoke about it a couple weeks back. Like, we seem to have all forgotten about the rest of the world that's still functioning. You know, we still have all the same fucking problems we had a week ago or 2 months ago. And when it comes to opioids, they're you know, for so long we were in the right direction. We had the database. We couldn't write a prescription for it without faxing it over. It had to have an original signature. All that shit is reverted during this. So, like, you have people, like you just said, you've got Suboxone and methadone being delivered to people's houses, being renewed by pharmacy. You don't need a physician to do it either right now. Yeah, and you could take a verbal order for renewals or for whatever narcotic. We just went back and cannabis somehow, again, what do we see in the media? This is driving me nuts. What are we seeing in the media right now? Don't use cannabis during COVID. It increases your risk of severe.
So many articles like that, and like coverage on the news like that within the past like 2 weeks. It's insane.
So what are your thoughts, Janelle, on that? Like, do you know, what are you seeing out there in the regular, like, fucking what are your friends saying? What are you doing? Are you walking out with a mask? Are you going to smoke a joint? Are you, like, what's up?
So it's interesting. When all of this started happening, they were like, oh, you don't really need a mask, right? So I'm just like, okay, cool, whatever. You keep your distance. And then they're like, oh, you actually do need a mask, at the point where you actually couldn't find a mask anywhere. Yeah. So my family and I were like searching through every retailer. You couldn't even find paint masks.
Right.
And I legit saw like people out wearing paint masks because they couldn't find medical masks. And it got to a point where like a family friend saw us out one day and they're like, man, you guys need masks. And they actually gave us a small package. But when you think about it, once you touch them and stuff like that, I mean, it's not really sufficient because eventually, right? So now the new thing is that everybody is making the cloth mask, right? Because you can wash them, whatever the case may be. And they're saying like it's better than nothing. So I'm seeing everybody saying like, oh, I'm making cloth mask, I'm selling the cloth mask. And that seems to be the uptick right now. For me personally, I will admit I still smoke. I'm not doing it as much. I don't smoke very often. It's more kind of like it helps me relax and it helps me sleep better. So I'm kind of doing a mixture of smoking and edibles, but I'm getting everybody going like, are you smoking? But I'm into the edibles a lot more these days.
You know, it's interesting because they used to talk about they talk about the inflammatory process that cannabis causes in your lungs. Which is why you shouldn't do it. It's not cannabis that's causing this fucking inflammatory process. It's combustion that causes an inflammatory.
Basically.
The truth is there is an increased risk of bronchitis for people who vape. But if you're vaping at a low dose, it's still safer than using your opioids and your other narcotics. If we look at how many people have died, I mean, yeah, there's been 2 million people in the world that have been affected by COVID. But and a lot of death. It just hit us really quickly. But we're going to come to a point where we start to understand it a little bit more. Anyway, it's so crazy. Okay, so Forbes, back to so you're in cannabis now. We're at this point where you have a bunch of stores, and in the last 3 months, it appears that retail sort of took a hit. The whole industry took a hit in the last little bit. Where do you see happening in the future here? Like, where are you heading? You also work with, so just to let people know what you've done in the past, all right? As a list of stuff that you've done in the past. This is a guy who's sold over 30 licenses to Choom, started Choom, built out Choom, then went into another LP, Sitka, which is a craft grow, yeah? Mm-hmm. And that's a craft grow, and then Clarity, which you're wearing right now, which are a bunch of retail stores as well. This is a guy who's got his hands in every part of the cannabis industry that you can possibly imagine, and he's got a whole bunch of clinics out west as well. So this is a guy who's got like, he's got his hands in deep in all of this stuff. So are you afraid? Are you seeing what's happening? What's happening with your stores? And what do you like? All I'm reading, Aurora's taking a hit. I'm reading everybody's closing down.
Yeah, you got to remember that, you know, a lot of people got into cannabis like the gold rush, and they were, you know, buying licenses hoping to flip them for profit. And I think a lot of them have got into carrying lease costs and you know, underestimated construction costs and just costs in running a business. You know, I've come from retail. I've done retail for, you know, the last almost 20 years now. Just, you know, and in retail, it's death by a thousand paper cuts for a lot, because if you're squeezed, you're the middleman between, you know, the producer and the retailer. And so your margin is based on a squeeze of both of those two sides of you. So you have to be quite nimble and entrepreneurial to be able to be in the cannabis space. And I think that a lot of the problems is you get, you know, these big corporate overheads in these big public companies, and they all have their egos of flexing this and that, and they come from this star spangled company and this and that, and it's like, yeah, but that's an established industry. So you can, you know, they're used to their $200,000 plus salaries, and you know, so when they run out of money and they don't have anywhere to dig into, you know, cash flow these things, you're going to see a lot of pain out there. And I think that we're still at the tip of the iceberg, and I think it's going to get worse for a lot. I think that, you know, the entrepreneurs are going to succeed in this because of they're able to spin on a dime their direction. They're able to take a zero salary and you know, be nimble and cheap and cheerful and work it through. So I think it's going to come down to the quality of the operators and the financial stamina of them are going to be the winners going forward. And I think that there's going to be a lot of blood in the streets for those that aren't.
So what do you think is going to happen with the retail space in the next little bit? I mean, I guess you guys are still open. I see cannabis from the retail. It's been increasing in from what I'm seeing. I think the LPs are the guys that are suffering right now. No,
I think it's going to be, you know, this is an emerging market, so you're going to have good years and bad years. And I think that you know, it's like what Warren Buffett says, right? When the tide goes out, you can tell who's, you know, swimming without their trunks on. Right. And the tide is definitely coming out, and you're seeing that, you know, there's a lot of more licenses out there that guys are just, you know, you can pick through dead man's wallets right now and say, well, I'll just take your license and assume the lease costs going forward. So right. You're going to see an amazing opportunity for those that are capitalized and know what they're doing to expand through this drought. And I think that the strong will survive.
Right.
I think it's a great, like, I'm excited about the future in cannabis more so than ever, because, you know, before you couldn't really tell, like, it was all positioning and posture and look at your spec deck and this guy comes from here and there, and it's like, it doesn't matter. It matters what you actually do. And when the going gets tough, those are the people that are going to succeed. And so this is in my sweet spot where I'm like, you know, in pharmacy, it's not easy. You're competing against, you know, billion-dollar companies. There's a drugstore on every corner. Like, you cut your teeth in that area, you can definitely cut your teeth basically running a bunch of coffee shops. Like, it's much easier running cannabis than other forms of retail. I can tell you that right now.
Really? Is that because of the opportunity? The world it's not as dense?
It's not that complex, right? Like, you have one supplier, which is the government. You have a couple hundred SKUs.
Right. Now I have a question.
A drugstore, you have hundreds of suppliers, and you have millions, like tons of different price points of departments, and, you know, there's a store within a store within a store, and there's different insurance plans, and it's riddled in red tape in pharmacy.
as far as your sales are going right now, because I know everywhere is kind of saying that there's an uptick in sales because everybody's home isolating, but we're also seeing all these news reports saying like, don't smoke cannabis. Are you guys seeing an increase in the edible and like tinctures and stuff like that? Or or is it fairly balanced? Like, what are you noticing any differences in your what is being sold right now because of COVID?
Edibles just came out though in like, December basically, and then the supply chain kind of ramped up in January, and then we have this COVID hit like whatever end of February. So it's hard to tell the data, but definitely, I've seen an increase in edibles for sure. There are supply issues still with.
Are there supply chain issues right now? Are you experiencing supply chain issues like they are in a lot of the other areas because of this this thing?
The supply is tight. Like you got to get up earlier and place your order because of if you snooze, you lose. Literally.
So, yeah. So you're not waking up at 11 o'clock.
No,
unless it's a good night.
But staff are getting up at midnight ordering stuff when the portal opens. Oh yeah.
That must make sense. So what do you see happening here in the future for so you think there's going to be a lot of carnage, and what's the future for retail? What do you see happening in the I guess in the next year? I know we're stuck with COVID, so like what the fuck? You can't even predict anything. I mean, I guess cannabis is really lucky. We haven't really taken a huge hit because it's still, people are always going to use cannabis no matter what. It's like you said, it's already a defined market. The market is there. Mm-hmm. And so what are you seeing the future looking like? You seem to not be so concerned about it. I guess you're right. The people that are concerned about it, Bay Street is concerned about it because Bay Street is the big business came in thinking they'll just run it like everything else, and this merging market isn't kind of like that. It's more like Silicon Valley. So what are you seeing the future?
Yeah, if I was on Bay Street too, I would be worried because of a lot of public companies they'll just spend money, and then when they run out of money, they'll just go back and raise more money. But that now is over because investors are scared and they've lost, 30%, 25% of their money already in the stock market crash. And then are they really going to they've already seen cannabis is down, 80% from the highs. So are they really going to be, able to, have that courage to then invest and double down into cannabis? Right. I think it's slim pickings. And so, I think it's about focusing on your expenses more than your gross sales right now. And so in a rising market, people are just more. Like look at how big, the producers were, I got 1 million square feet of funded capacity. I got 2 million.
It drove me fucking mad.
It's like, but what can you execute on, and what does the market need?
Yeah.
Right. And so I think there's more common sense going forward now in this market. Everything's kind of slowed down, methodically going through and opening up the right locations that make sense, and taking it at much more of a stable business expansion going forward. So, but yeah, if to answer your question, I'd be scared for the Bay Street investors too, because a lot of the public companies have huge overheads that they're not reducing quick enough.
Yeah.
What are your plans for the retail market? What's the plan out west? What's the plan for clarity?
I'm still expanding. Like I'm still picking through the right assets and executing on biting off as much as I can chew and swallow, and just enjoying the day, that being grateful that it's I'm grateful to be on the West Coast and to be healthy and to have businesses that are in this sector and cash flowing through it. So I'm grateful.
You're definitely enjoying your day out there. Jesus, it's not like it looks
beautiful.
Pretty sunny. Is it?
Yeah.
Well, you're in Victoria, yeah. You're doing something else that's really interesting in the COVID space, or in the SARS-CoV space. You created an app that allows people. This is the kind of entrepreneur this guy is, and he basically gave it away. You created an app that allows people to do a self-evaluation, allows people to call in, has physicians, has a whole team. What are you doing? What is that, and how is it being used by your city?
So, I mean, I think it comes down to like I just, when I see a problem, I just can't help myself and I want to help and fix it. And I was seeing the government flap around with just counting numbers, and I'm like, well, where are the masks? Where's the PPE? Like, why isn't anybody doing this? Where's the testing? Like, why isn't there any testing? Right. And especially when you know that most of the cases are asymptomatic, or a large percentage. And so I got to work, and I took, you know, from my ageless living, I had doctors and internal med specialists, you know, Dr. Lim, Ira, and some of the nurses there. And then we scaled out and built an app that would be able to have a call center click and, you know, fill in the blanks as you go through the questionnaires for people, so that it's following the CDC guidelines, and it ranks the severity of the symptoms and who needs to be tested urgently. And then we would have a nurse follow up with them, call them, and then a physician would dial in via telemedicine, assess them further. And if they were sick enough, we would send a nurse trained in hazardous, like biohazard procedures, fully with, I actually got all my PPE equipment donated from Canopy to us.
Wow.
Right?
Really?
So, for free. And, you know, so it's just being resourceful, like get your equipment, line it up, use the internet, use your resources, figure it out. And then, so we're actually doing in-home testing for COVID, because it doesn't make sense to, you know, have people, you know, with 811, there was a 3-day wait at times, right? And people are scared, going, oh my gosh, I think I have COVID. I'm not feeling well. I need to go get help. And so where do they go? They get in their car, they go to the ER, or they go to the walk-in clinic or wherever. And on the way, maybe they're picking up some milk and eggs and spreading it.
For sure.
So we're bringing all the services to them and following the mandate of flattening the curve and staying home. So we say, stay home. We can ship you medication if you need it. We can ship you a doctor, a nurse. We can test you right in your home. And if your symptoms get more and more severe, then we can at least notify the ER, like, hey, we have a COVID patient. They are positive. We're confirmed. Here's their medical chart. FYI, they're coming in. Be ready. And so the physicians at the ER have been grateful for our service.
So why the fuck are we not doing that?
I don't know, man.
It doesn't make sense.
And everybody thinks that, you know, like, you know, Ira, like, how many good physicians and nurses do not work for the government? They're private, and they want to come and help. It's a massive amount of people.
And you're funding this, or the government is funding this?
I fund it. It's costing me money, so it's my staff that I've paid to get this going. And then the city of Langford with Stu Young, who's very entrepreneurial and forward thinking, they were really upset about the government's lack of response as well. And so we've got funding after the fact to build this out and sustain it to help the city. And so yes, I did get funding after from the city of Langford.
So this was a philanthropic endeavor that you took on as well. So not only working in the cannabis space, not only working as an entrepreneur, but as a good fucking decent human.
Yeah.
Like, we need a lot more people like you to be able to do things, who can do things like that. There are people that can't. There are other people, but where are they all right now?
Right.
Well, think about this too, Ira and Janelle there, that you know, you're looking at the government hand out billions of dollars to help people not freak out and have an income to put food on the table and a roof over their head, right?
Yeah.
Well, that's taxpayer money, right?
Yeah.
Why aren't the cities able, like, and you have all of this carnage with, you know, workers being let go and they're scared and now they don't have a purpose. And so if you think about, like, for a city to spend say $20,000 a month or $30,000 a month and hire laid off employees for the call center to then cycle back the money, like it doesn't matter if it's federal money or municipal money, you're still putting people back to work and helping their community.
It's actually a great idea.
Like, so why just sit at home and do nothing when you could still go back to work with the same government money, it's just municipal, and then help fight your community?
Shit, I don't have a good answer why they're not doing that. Janelle, what do you think?
I mean, when I listen to this, I'm like, wow, this is common sense. Like, you're literally making people earn the money, which is essentially what people like to do. A lot of people don't like handouts. They like to know that they're earning their own money. And if you're going to be giving the money out anyway, why not have people work for it in a way that's benefiting the entire community? When I hear it, it makes so much sense. So it's like, why aren't we doing it? And I don't have an answer.
Doesn't make sense. Mike Forbes, this is the guy. He's solving problems everywhere he goes. This guy. That's why I just want I hang on to his coattails to learn from this guy. He's a smart human, and I appreciate everything about you, Mike. Thank you so much for being here. We're not letting you off yet because we got some news to go through, and hopefully we'll get to continue this conversation more and more. But what we just heard here is that for people that are afraid the cannabis market is going away, we've got a guy here saying it's not going away. You just have to be smart and be able to pivot. The entrepreneur is going to succeed because they can do that. And big business have a problem because they're used to running these big corporations, and the world doesn't work like that in the emerging market. Sure. I love that. That's very true. And you actually just gave me a lot of hope as well. About the market, and there are people getting into it. Anybody that's an entrepreneur can find a way to be in this market, and it's just starting. Yeah. So what do we got going on in the news? Because I'll tell you, like, is there anything like good happening? Well, I don't know.
Interesting happening. I mean, for all of us who are cooped up at home, a little entertainment news is that the singer Khalees, she actually has a new show that's coming out on Netflix on 4/20, and it's a cannabis cooking competition. So they've pegged 3 cannabis chefs, and they have.
Who are they?
The names, I don't think they've released them yet. So
okay.
That's going to probably trickle down over the next few days. But they're going to be competing, cooking 3-course infused meals. And then it's going to be kind of like dinner party style. So they're going to have celebrity dinner guests who are cannabis advocates and enthusiasts. So people like Ricky Lake are actually going to be guests on the show. The rapper Too Short. And it's 6 episodes, and it starts on 4/20. So I think that's going to be pretty entertaining over the next few weeks to kind of see how that unfolds. And it's kind of hopeful because when cannabis is going mainstream, basically, when you see it coming on. I love that. Yeah, it's super cool. So I'm looking forward to that. I hope you guys tune in too.
I think that's actually pretty cool. Like, first of all, what's happening for 4/20? Nothing. Although, here's what I think. Just as an aside to that, we're releasing, Cannabis WIKI is releasing an app, the app that's going to allow us to do everything we basically do online, but you're going to be able to stream, you're going to do a whole bunch of stuff online, right? So maybe on 4/20, we have a sesh. We do like a party sesh on our app. And then we can watch the show. Because I'm down to watch it. I want to be a dinner guest.
That's amazing.
You sesh with us on 4/20?
I like it.
Oh, yeah.
Beauty. Derek, you in? He's on mute. Can't hear us. Derek behind the scenes. All right. By the way, he's the guy that created the app. It's just he created everything you see right now. It's just a brainchild of all this multimedia stuff. So he created. We got this app that's an excellent app, and it's not just like a computer. Change your screen from the computer to the cell phone. It's an actual app. So I think that'll be a great way to get it going. 4/20 sesh. Beauty. What else you got for us?
Well, some good news coming out of the cannabis industry is that a lot of companies are offering like their frontline employees who are still, in the stores, still dealing with people, offering them little pay increases and other benefits to kind of make up for the extra long hours. So we're seeing $2 hourly increases. We're seeing benefits like getting samples of the cannabis weekly. And also some of them are actually giving free Netflix subscriptions for the employees that work from home.
Really? You got any free subscriptions there? Forbes, you giving them some free Netflix? Yeah, no. Yeah, look at that. No. But he's keeping them employed, yo. Which is, so many people aren't employed right now. It's funny. It's so crazy how all these people, we went from literally like being like the most underground market a decade, 2 decades, a decade ago, up till 2018. There was no legit jobs. And now we're the only ones that are employed. Like, you see everybody's still going to the stores. It's kind of great. So it's how the world turns.
Yeah.
So
anyway,
a little controversial.
Okay.
So, I don't know if you remember the author Alex Berenson, who wrote
hate that guy.
Children the Truth About Marijuana.
Oh, he's such a dick. No offense.
He's continuing on that path.
Oh, he's such a dick. Hold on, I'm going to interrupt you. This guy is so... Actually, you can watch my good friend Dr. Mike Hart debate him on Joe Rogan's podcast. This is a guy that says, he uses cannabis causes people to more violence, more sexual harassment, and psychosis. That is like big... It's, he goes by the he who yells louder wins theory versus actual data.
Well, he made some remarks this past week. Basically, he's kind of trying to link the COVID-19 outbreak with cannabis use.
Yeah, of course.
He's basically stating that there is a strong correlation between the places with the most cannabis use and the places where the epidemic has really taken off. So he's, again, making kind of outlandish claims without any kind of scientific proof for it. So not really surprising coming from him, but controversial nonetheless.
All those cannabis users in Wuhan, China. There's like, come on, this guy is such a nut. It reminds me of the people that are all these conspiracy theorists that are trying to come out and tell us all these like, 5G has caused COVID-19. What kind of horseshit is that? So there's like 2 5G towers in the world. And it happens to be one in Wuhan and then one who knows where else. But you're telling me the other 240 countries that are plagued by COVID is because of the 5G? Come on. At some point we got to just, there's no science. The people are just dumbasses.
Yeah. I don't even know why news teams are even giving him interviews, but I suppose controversy gets people coming to your channel. So
people love that shit.
Yeah. Another interesting thing is that the Ontario Cannabis Store, one of their UX designers actually released some interesting facts. So they actually released the most searched brands on the OCS website. Yeah, so there were 12 brands that made the list as the most searched brands: Redican, Aurora, Soleil, Riff, Broken Coast, Edison, Pax, Tweed, Hooray, Dosist, Collab Project, and Hexo. So it started a whole question as to when cannabis became legal and we had all these restrictions on packaging and branding, is that conversation shifting now that people are actually searching for brands as opposed to like just a strain type?
That's, it's really interesting. And I wonder if the reason is, I look at somebody like Redican and I say hi, because, that's local to Hamilton, to where I am. And they're a good brand. They're a great brand, but they're also very reasonably priced brands. So most of the brands that you just mentioned all have very reasonable prices. You're not going to find pre-roll the same cost that you will for Redican. It just doesn't happen. So I wonder what is it that's going into that why are people Googling that? Actually, that's a Forbes question. Forbesy.
Sorry?
What do you... bastard. So the question was, so Janelle was just mentioning that, what were you just mentioning? Say that again.
The UX designer for the Ontario Cannabis Store just released the top searches on the website. and it was 12 brands that they released. So it started a debate as to whether people are now becoming more brand conscious as it relates to cannabis, as opposed to being like strain conscious. Because when they kind of put down all the legislation about branding and how you can market, people were scared that that consumers wouldn't really shop by brand because there would be no brand recognition. But the search results are kind of telling us a little bit different right now.
So then the question was, Ready Can was up there, and a whole bunch of Broken Coast was up there, Dosist was up there, Soleil was up there, all these guys. And my argument is, I hear Ready Can, and they're local to Hamilton. I like them a lot, but they also have super reasonable pricing. Do you think that, what are the factors? What factors do you think are really important for companies to take into consideration that will get them that brand recognition?
See, I still struggle a little bit with the brand recognition. I think it's more about the quality of the cannabis and the strength of the THC. So people will always ask, what's the THC percentage and how, like if the bud is dry and cracked and whatever, right, they'll remember that. So I still think brand loyalty is building with trust with good quality cannabis and a high THC. So
do you think overpricing?
The cheaper stuff has its market for sure, but I don't know. People are it's a lot higher price than the black market, and I thought it would be harder. But prices are coming down all the time, and I do think that still people are preferring the convenience and the quality over the price.
Are the margins, the margins between, because you guys are at the end user, the government still has like the in-between portion between the LP to the government to you guys. Are those margins slowly, are they getting really small, or are they still fairly wide enough to be lucrative enough kind of picture?
Yeah, that's a really good question, because I'm on a call shortly after this for what the feedback for the government, and I think that the government pricing should set their prices a little bit higher to give more margin to the retailer, because they kind of set the tone. Like if they're say $20 for a product, it's hard for us to compete, so maybe we're at $21, $22. Right, so we have to be a little bit above them, because they have a 15% head start on us with their margin, just because of the government and the way that they're wholesaling. So it'd be nice if they increase their margin a bit more to leave a little bit on the table for the retailer, so that say they went up to $22, then we would be at $24.
Right.
And in retail, you follow, you watch the nickels and dimes, so the dollars follow, right? And so that margin, like I see a lot of amateur behavior in the cannabis space with price wars and dropping their margin, all this crazy stuff, when I think that that's just a race to the bottom, and you've got to command service and quality, and that's what creates a business, not just price.
All right, I agree with that. Yeah, it makes a lot of sense. I know that, in the medical side, people are a lot of our patients are ODSP and can't afford all their medicine, so pricing becomes a huge barrier to access. But I understand your point in the rec market is service and quality over pricing, and I think that usually wins for the most part. That's a good point.
Well, I was operating, so my private pharmacies, I had a Costco right across the street. And so Costco is, they don't run the pharmacy to make money. They actually lose money to get people in the door to buy lawn chairs and chicken and whatever, right? Yeah. And so it's super hard to compete with Costco. So you can't play that game of price war with other retailers like that. What made me successful was listening to your customers, servicing them, offering a superior service, quality. That's what people will honor and create loyalty to.
Makes sense. That makes sense. What else you got for us? Are we good?
Last but not least, this one's actually kind of entertaining.
I like entertaining.
are pumping $1 billion into the economy by shopping while stoned.
Sorry, what's that?
We're actually pumping $1 billion into the economy because we're shopping online while stoned.
Because everybody's got time to be home, so they're all getting high. That's amazing. That's awesome. You know what's really funny? Okay, so Derek, in the back, that meme where that the kids of the millennial. This is a great fucking meme. The millennial wearing the gas mask. The millennial before. I think I sent it over. I don't know if I did. Anyways, there's this meme that I saw. You've got these millennials before COVID saying, "Oh, I want to die. Oh, I've had enough." COVID's during the millennial wearing the gas mask because they don't want to die and on their cell phone. You know what I mean? Because that's really what they're doing. So I think that's kind of funny. You know, at the end of the day, everybody's at home right now, and all the problems that we had before, nobody's thinking about those problems, and everybody's just getting high. Because why not? But anyway, all right, that was fun. I think we've beat this one down pretty good, and that was a lot of fun. Forbes, thanks so much for being around.
That was so amazing. Thank you so much for having me. It was awesome.
Thanks. Yeah, and thank you. Looking forward to doing all this stuff. And I got to come out, bro. I got to come out west as soon as this is over. As soon as this thing is done, we're allowed to travel, and I'm out of the hospital. You know, it's funny. I'll have to take 2 weeks after. I'll be in isolation still for 2 weeks as the last shift. I'll still be going into isolation until this thing's done. Anyway, thank you all for listening. What a great episode. Thanks, Janelle, again. That was awesome. Had a really good time. And stay tuned. All right, everybody. I think I'm done. Janelle, anything else to say?
No, that's it.
All right. Don't forget 420. Do you have anybody you want to, anything you want to, tell us about, any like names, promotion stuff, tag stuff there?
I want to thank all the frontline healthcare workers and essential service workers for having the courage to get up every day to go and help their community, and I salute you.
Awesome. Thank you. Well, we salute all the pharmacists still willing to see 400 patients a day show up to their pharmacies. Yeah, I mean, that's tremendous. I tell them every time I go, and the truth is, I thank them. I thank the people cleaning the floor, the aisles that don't have full PPE on. Like, it's crazy what's happening out there. So thank you to all of them. And don't forget to check out all of, I can't even start going through all of Forbes' stuff, but don't forget to check out Sitka. Don't forget to check out Clarity, Choom, all these things he's got going on. Don't forget to check out Cannabis WIKI for your latest news, entertainment, lifestyle, everything you can think of, podcasting, cannabis directory. That's really important. And we have an app coming out, and that's going to be really awesome. Can't wait to share that with everybody. Don't forget 420. We're going to do a sesh. Don't know what time yet. We'll put out some evidence. We'll put out some times and all that stuff. We'll all sit around a table, and because I got high. Anyway, this is Dr. Ira Price. Hope you're having a wonderful day. I said doctor and get high at the same time. I love that I could do that. Anyway, all right, bye.